So I'm going to show her which tools. Probably she can choose both. And they made beautiful temps. They followed exactly my wax up restorations. I have to open the interproximal contact that I'm trying to make good proportion from what she had previously. Can you take a look at it? Any concern about the temporization? Beautiful temps.
Yeah, they're pretty good for
She did a nice job with doctor.
The color, obviously, a little bit.
Color, I got that. That's
Yeah,
why
that's
you are
you.
here.
Yep.
Is
But
there
the
any
shape is good.
shape and contour? I really like the emergence profile from the tooth, the top and bottom. That's really cool, right? And the midline, that's good. Let me see. Okay. All right. So any concern about?
No, not about the shape.
Then why you are here?
Color. Come on. You told me to come. I don't know.
All right. So now we can check the color.
Okay.
So difference is between the dentist has all this. It's just a gray shade guide. It's an ivory cloud. People then they made the bleaching color. It's very nice. They have another B1 types, but I developed is more lifelike restorations compared to what they made it. So differences is this is composite fabricated. This one kind of dental types. So my shade guide with the zirconia basis. So not only zirconia, so we can go with the press types. So using the different press type, which is especially I try nowadays is amber, and that one is a really perfect match. So I'm going to show her which tools. Probably she can choose both. So can you choose here?
All the way towards you.
Okay, she's just bright.
Is that
Right.
too bright, you think?
Yes,
Too bright?
to right for your
Little teeth?
your little teeth.
So the middle one?
In the middle one, better,
Yeah.
right?
Yeah. I can bleach my bottom still.
Okay. How about this in case?
Too yellow.
Okay, so I'm going to take the two.
Okay, you want me to hold it?
Yeah, sure.
Okay.
And then I can show them the street guy, which is the Hollywood smile, a cosmetic celebrity smile. So now you're a celebrity. I'm trying to
Oh,
give
good.
you this. Actually, this one is a signature ceramic. It's not a normal ceramic. So I'm trying to put my experience as much as possible.
Okay.
So you can take a look at it. It's too bright.
Mm-hmm.
It's still bright. I have a more variety, about 5 different colors. With the differences is translucency. So what you choose this or tool. So probably you choose between
The middle ones.
the middle one.
Yeah. Okay.
Okay. So I'm going to take it out this.
Okay.
And also differences is here. So my shade guy is about about 2 millimeter, but this shade guy is about 6 millimeter thickness. So doctor gave us less than 1 millimeter thickness. So I have to utilize this better opacity compared to what she had. But not only that, I have to give them some more translucency between the incisor and third. So now I have her choose it. So here, 3. Okay, I like middle. What do you think?
I like one of these two.
See,
Not this one.
thank you.
Okay.
I did not pay her anything.
Correct.
Okay, so what is difference is the value. The value meaning the reflect of light or observe of light. So this one is very observed the light. And also here's a different hue. And so I'm using our zirconia shade tab into her. And then probably I can make this slight opener. Thank you. I'm going to make this half about this color. The other half was here.
Okay, you don't think I can go all the way to the right?
That's fine.
What do you think?
Well, what I think usually when whoever can E doesn't make edge to edge. E R. Okay. So I all the time follow the lower teeth. But like she said, she's going to bleaching. But usually bleaching is 1 or 2 tone down.
Yeah,
That's about
so-
it. It's not like exactly like this.
Right.
So if my teeth,
Yeah, if they were your teeth, what would you do?
you're not going to like it. I'm going to make a little bit brighter than this.
No, I like one of those.
Got it. Okay. So So I'm trying to follow this one is a little bit less white
Yeah.
than this. Totally depends on the patient. So some patients say, no, I'm going to do lower in the future, so I could do that. So some patients say, no, I'm going to do bleaching more, so I can follow that. So if I were you, then
Mix them.
mix it.
Okay.
And then you can see the incisal translucency. That's the key. So whenever I change it, here, thank you. That was really cool stuff.
Yeah.
So then when I give them some more lifelike restorations in between
Okay.
teeth, and not only that, I'm trying to match with the lower inside translucency, and it shares a different hue. Okay.
Yeah.
So then I can choose mix and match. Then I do have a formula for my shade guide, and then we're using the amber with the press materials, and then I can make us is a really good information. So what I see usually, I have to see the patient smile line. See, okay, and then I'm trying to make the 8 and 9s make more symmetry between the teeth. Its gum line is perfect. I really like gum contour. This is most key to success to make custom shade the restoration. And also I'm trying to matching the lateral in kind of sizes make more matching. But what I like it's a little bit offset is more natural to me. Otherwise I make piano tools.
Oh,
Right.
not piano too.
Okay. Then K9, I'm trying to make a little bit differently, and the vocal corridor, I follow it, and the midline is perfect. I mean, this dentist, we have to mention it. Doctor's name. Who's doctor's name?
Prita.
Prita.
Yep. She works with Dr. Eileen
Okay.
at Naperville Dental Specialists under Dr. Labaka.
Great. Okay, so that's the information, and they made beautiful temps. I mean, they followed exactly my wax up restorations. So first, I'm going to give you the more preparation regarding the teeth prep. So my job is I'm not trying to prep a lot, but I have to open the interproximal contact that I'm trying to make good proportion from what she had previously. So I made it detailed preparation. So then I wax up, probably I wax about 4/10 or 6/10 millimeter, and then I made a wax up. I made a special guide for the temps reduction guide, and then she made the temps really cool. I mean, I wish I can get this is in a daily basis. I mean, you're lucky so far. That's so nice. I mean, there's tissue adaptation is very good. I can see the color. Actually, this one looks like natural teeth to me. You know what I mean? But whenever I make this much brighter, which is I show her, then I can follow it. So now it's my job, the laboratory, which is a lot of dentists trying to mimic with the laboratory work, but it's really hard because I had over 33 experience with my passion. So I research with the natural tooth, and then I follow the tooth shape and contour, which one is the best, whatever, which means is the midline, and then 3 dimension of the tooth, long axis, incisor open embrasure, and then make this better contour and also emergent profile. So that kind of things, which is what I did with the wax up. When I do the cosmetic restoration, we must follow it. Otherwise, it's not a perfect restoration. I know I all the time say I'm arrogant. That's why I'm trying to give them my final signature line put here, just like cook, right? So I'm a good cook. So I do have a good foundation. I'm a good materials, which is doctor provide us, and that I can make these better ingredient and mixture and shape and contour. And then finally I check with the texture, which is she's good. So here's the things, whenever a patient has a saliva and with more shiny, but whenever they open it, it's dehydrated, and then I can see it more texture and the different color tone. Okay, that one is another job. Then lastly, either I can do with the 35mm camera, so I have to take documentations, which is my side, and then I can get a photo, which is what I talk exactly. I can take the photo with my shade tab, with the side view. Let me show you how I take it. Could you hold your lips just like higher? Thank you. Open up. Thank you. So those things I can take a photo with a 35mm camera. Okay, so here. Okay, great. Thank you. So like this. So I got the photo. This. Okay. Okay. That one was exactly what I'm talking about. So this is the guidance. And then I can write it down about midline and talk down, whatever. But good part is, so most of the time, a doctor could not make the perfect temporizations. So then I have to make more incisor edge higher millimeter, open incisor and more midline move it. And then colors recipe here too. Vocal corridor, I have to write it down. Okay? This is the last. I'm using the 13 Pro and you can use the 14 Apple. It's not a problem. So what I do with the videotapes with this, with the patients, so while I'm build up, while I'm matching it, so I see my video here, the color, then I can finish this final cook. Make sense? So such as here, E like this, thank you. That one is what I'm talking about. Make sense? Alright, this is the behind the story. I can make this now lower. Thank you. I can get this. Okay, so like I said, pretty bright. You see? Thank you. Let me check your size. Okay, now I did it. And also I can do with some photo. So that one is the A-unit cosmetic makeover cases from the what patient concerning. And then I had all documentation and include the material selection. And the prep color is very important too. So probably you have to cross them. So what prep color after they prep it? Probably maybe dark and black and maybe problem. So I have to using the another different ingot selection in order to match the same uniform color. Then I got the occlusion. We check with the dental articulations, bite is good. And then I can get the photo. Alright, so like this. Side view. Here, side view. And then now frontal view. She is very good. She's photogenic too. Right here. You see the great information from eye to nose and teeth. So now I got the full information. So, any question?
I don't think so. How long does this process take?
When is your appointment? Usually 2 weeks.
Yeah, it's in a couple weeks.
Oh, great. So usually we fabricate the 2 weeks. It's not a problem. We already got the impressions a week ago, and we already process it, and then we already press wax up already, and then we check some of them, so which is pretty good. So that is the cosmetic selection. I can do so many different things, but I would say, even though I'm a high-end technician, I have to listen what patients want exactly. So I have to follow, for example, like I said, all the time compared to cook. If she doesn't like the spicy, I'm trying to get rid of the spicy, right? If she doesn't like onions, I take it out the onion, right? So I'm trying to make her a good cook, basic foundations, but it's much lighter, will be. But I'm trying to make her happy. So when she big smiling, when she talk with someone, then not noticeable too. That's my job. Otherwise, if I make fake restoration and then I hate it, someone said, "When did you make your fake teeth?" I don't like those kind of things, right? So I'm trying to make the good job. Anyway, this is another education tools. You can see my before afters. I made so many things. That's our color differentiation, shape difference, size difference, so many different things too. With the patient, what I like her translucency. This is most of the time in a doctor and patient all the time fighting. So what I like, I'm a technician, stupid technician, right? So trying to make the more nice translucency, deep translucency. But what you said?
I don't really like
You
them.
see? So okay. So I have to get rid of it. Here's I just let you know. If I put translucency in Mamelon, just like textbook. If I put it in there, I'm not going to put yours.
Okay.
Don't
'Cause
worry.
you can't,
You see,
when I
she penny.
smile, Luke, when I smile, you can't see my bottom teeth.
Sure, absolutely. But what I'm saying, if I make it just matching the lower teeth and with a more darker color, I'm not going to. Don't worry. And with the translucency with the mamelon, boy, I'm going to put the famous magazine because it's so natural, lifelike restoration. But this is a reality. I'm not going to put that much translucency, just subtle, a little bit, like I
just
said.
a little bit. Okay.
It is really behind the scene. But I am struggling sometimes because if I put more, it will be gorgeous. I mean, just like fantastic. It's just world class. I mean, natural lifelike restoration. But unfortunately, this is the Hollywood, United States.
I don't live in Hollywood.
I know the Hollywood style, Hollywood style restorations.
Okay.
Case minimum prep, which is trimmed a little bit more, and the veneers. That's an 8-unit case. There's now wax up with the amber. Check the margin. Now we finished the 6-unit, 8-unit actually, the cosmetic restoration. You saw our custom shade matching procedure with the patient in this previous video. And then now after 2 weeks later, and then we perform the cosmetic aesthetics restoration using by amber with different lithium silicate materials. So make really cool cosmetic restoration, but exactly what patients looking for. Bright, less translucency. And here's a trick actually. Before perform the wax up here, we give them the prep guide, which is trimmed just like that. The doctor gave us really good prep. I like that. And then whenever they're using they would like to the high value, then they can use the white cement from here because its facial thickness is about 5/10 millimeter. So they can use white opaque cement that can increase the value, which is great. Or they decrease the value, they can use clear. Or OM2 color, that'll be good. So that's another cementation technique for Dr. Chairside. So they can finish that one. Anyway, from the beginning, and then we finished the final Hollywood smile cosmetic restoration, not only contour and shape, but also the color from the design matching. And then that one is the final. Okay, thanks for watching. So you utilize our ceramic shade guide 8.0. There's a good communication between doctor, patient, and the technician as well.